Yes. This is a mandatory session. I know that we only have about 50% of the students, and everything that is discussed here today, every student is responsible. I know that you have a group or WhatsApp group, etc., that you can share the information. Please make sure you're sharing the right information. But one thing is certain, that the first two slides that we're going to be going over, all students must abide by that, so that we can ensure that you get a successful class experience. So with me today is Miss Lindell DeVoe. Everybody knows her, and everybody would have met myself at some point in their career, or they say their experience here at the university, their trajectory at the university. So what's happening is this class is for approximately 48 hours per week. And what that simply means is, for the first, there are 6 class sessions, or there will be 6 class sessions, of which each comprise of 8 hours, Monday through Saturday, 48 hours for the week. This is very, very important, because if you are unable to do this, once you would have gotten the master list, one master list may have been circulating that is not correct. I will circulate the final draft between now and tomorrow, and so that you can get your lives together on how you're gonna make sure that you're there for that 48 hours, to complete those 48 hours. So it's very, very important. I'm going to repeat that again, that the 48 hours per week is very, very important. There is no makeup. Absolutely. This session is being recorded, and it's being recorded because I'm saying it again. There is no makeup. It's impossible. Just getting this session together for all of you was a task. There's absolutely no way to make up. And you notice that Ms. DeVoe isn't saying anything. So that means she agrees that there's no makeup. Okay.
Well, you know
if,
that.
if you get sick, if you don't fall within the university protocol for something happening, then absolutely there's nothing we can do other than for you to withdraw and repeat it again when it comes around. If you just can't do it, this is something that we it was very taskful for us to put this together. So I'm staying on that just for that moment, so that you can see, if you cannot do the 48 hours per week, if you need to make up, then it's a problem. Every student is to arrive 15 to 30 minutes prior to the schedule. Now, if I am there and the student is walking in after the 30 minutes, you just need to turn it back around. This is a serious situation. We are under the guidelines of PHA. We have these 48 hours that must be made up for the nursing council. Students are known. Sometimes I sit in the parking lot and I see students just rushing at 8:15, 8:30, trying to rush over to the hospital. Okay, 8 o'clock on the dot, you must be in and ready for report, not in and trying to put your bags down. So right now, the shift is at 3 and the shift is at 8. So 2:30, you should your first foot should be on PHA compound. Same thing at 7:30 a.m., the exact same thing. I'm saying this to everybody because I'm gonna be a stickler for that. If you're not there, then if you're there after the time, then I'm not gonna include you in the lesson. Okay, so make sure that you're there. However you do it, make sure that you're there. You're not to leave early. There's no negotiation with the PHA staff, and there's no negotiation with another colleague. That is, I'm not taking any lunch break. I'm not taking any breaks, and therefore I'm going to leave an hour early. No, there's no negotiation there. There's 48 hours per week, and the 48 hours per week is what we're going to adhere to. There's no swapping of time. You know, I see Miss Molly here. You may want to switch with Miss Sayers for her hours. There's no swapping. So the persons who you need to have discussions with about anything would be myself or Mr. Vo. There's no negotiation with the PHA's faculty, staff members, and no other staff member, including anyone at UB. It will just be myself or Mr. Vo. So there's no swapping. You are entitled to breaks. You to get 2 15 minutes break, and you to get 1 30 minutes lunch break. Now that there, based on what's happening on the ward, Mr. Vo, I was going to give a standard break and lunchtime,
Yes.
primarily because if that student takes a lunch break at 1:30 and I'm there to do an assessment, it's gonna be a problem. So I think
Yes.
I didn't have that discussion with you yet.
No, that's
but I
exactly
wanted-
along my thoughts. I would have interjected, but that is exactly, it is going to have to, we're gonna have to move in one frame. That is what's going to have to happen.
Okay,
So that when one do something, so I will know everyone is on break this particular time to that time.
okay, yes, yeah. Because it wouldn't make sense.
Yes,
Me to
no.
be there at a certain time and I'm waiting there for them to come from off of a break. Okay, all right. So we'll send out the times for the breaks. Okay, and the lunch. Okay, so this is the first frame that I went over. This speaks about the 48 hours per week, mandatory, no makeup, no leaving early, no swapping. You're to arrive a minimum of 15 minutes, but if you can do 30, that's even better. And then prior to your shift. So everyone should be getting report and already prepared. One of the things they said, try not to bring too much material with you because you know this is the COVID environment. And you will be going through, if you've already not done so, the IPC course, and you'll have to be draped and everything. So, you know, leaving and coming on the unit is something they frown upon. Any questions? 75 of you on this screen here, 75 students. Any questions? First,
Just a moment. Anyone who's, Dr. Adley, just a moment, please. Anyone whose microphone is open.
sorry about that. Sorry,
Mr.
but that's
Vo,
all right. I was using the wrong
Sorry.
person. Go ahead,
Yeah.
go ahead.
I'm just saying, you can hear me now?
I can hear you.
Yes? Yes. I'm saying that anyone whose microphone is open, close it unless you're saying something so that we could minimize the background noise. Unless you have you are immediately saying something or asking a question, just please close your microphone as soon as you finish speaking. All right?
Okay, go ahead, Tina.
Hi, good afternoon. I have a question regarding the infection control class. I did that class, I believe, at PMH. If I can prove that I did it through the education department, I didn't get a certificate because they weren't printing at that time. But if I can prove it, can I bring any form of proof to show that I actually did an infection course at PMH? Is that okay, or I have to start back from scratch?
Everybody on here is supposed to have done an IPC course with the University of the Bahamas last semester. This is something else that is mandated by PHA. As you all know, last semester, 2 semesters ago, we tried doing something to assist your colleagues to get through this program and so that you can sit the nursing consult. A few of your colleagues did some things. The nursing council found out about it and they stopped us from doing it. There is 100 and something of you here. If one of you do not bring your PCR tests, if one of you do not take that IPC course, if one of you decide to leave early, not do your 48 hours, this entire system will shut down. Okay? So we are following some stringent guidelines. This is not about me, or it's not about Mr. Vo. It is about us following the stringent guidelines to help get you out. All right, so right now, that request is coming from PHA. We've informed them that all of the majority of you would have taken the online, which you do have a certificate for it, and they want this to happen. Okay? They want you to physically come in there and do whatever you need to do with them. That is out of our hands. Once again, if one student do something, just like it happened last 2 semesters ago. We were doing very well. 1 or 2 students did what they wanted to do, and the whole entire system shut down. All right? So we hope that the first group that comes in follows the protocol, the second group up to the 6th group, so that you guys can get out of here. Okay, I hope that answers your question. Go ahead, Miss Burrows.
Okay, my question is pertaining to the 30 minutes prior to shift. Are we doing some type of pre-conference like at the nursing school like we used to do before we head over, or it's just a matter to make sure that we're on time and ready?
Any part of that can occur. That means that once you're there 15 minutes before, Mr. Vo or myself can be there. And of course, ICU has a waiting room that we can have a pre-conference in there. And so does the emergency room. So that can definitely occur.
Okay, thank you.
Ms. McPhee?
Hi, morning, everybody.
Morning.
I joined a little bit late. I have a question. I am in Miss Jolly's section, but there's no specific schedule for us. And every Friday we have to go to her class. What happens to us?
No, is your name on the list to be at the 412? Are you on the list Monday through Saturday?
I don't see my name on any list for complex. It's there for management.
Okay, so if you're only those names that are on the list. I didn't check the names. I know that I have a list of 120 something students. No, I didn't check.
Oh, I didn't see that long list. I only
Okay.
saw a short list.
Okay.
And so I was wondering.
Yeah, once I get to the last of the slide, I'll just review that real quickly. And then we'll see if your name is on there. But if
Okay, ma'am, I have another question.
Yeah.
So I just came back in the country yesterday because I went to my dad's funeral and I
Okay.
returned yesterday, so I didn't get to attend the mandatory class. Will there be another one?
There are 2. There is 2. And it's on the schedule.
Okay.
You'll see it when I pull it up at the end of the session.
Okay, ma'am.
Mhm.
Thank you.
And my condolences to you as well.
Thank you.
Okay. All right. So no more questions on this. I'm going to move to the other slide. That brings us to the PCR and antigen tests. It needs to be 24 hours prior to your clinical. The thing about this is, when you bring this, you're not bringing me a screenshot where you cut and paste something. This is a real document that I need to see in my hands. Falsification, not only will you be expelled from the School of Nursing, it's also something that is governmental as well. So please do not even think about it. Doesn't make sense. Either you have COVID or you don't. That's it. If you have COVID, we don't want you there in the hospital to jeopardize the patients and your colleagues' chance of finishing this program. You need to present a negative PCR or antigen test that was taken 24 hours. So classes start on Monday. That means you have to do it on Sunday. When you get it done, there are places that are open on Sunday. Please avail yourself of that. And no long talking. There's nothing to talk about. Dr. Adley, I didn't do it. I forgot it. No long talking, please. That is to be presented on the first day that we see you, which will be Monday at 7:45 a.m. You are
That's
to
Dr. Adley.
yes.
That's Monday. I don't want them to assume you mean Monday coming.
Oh, no, I mean, the first
Yeah.
day that I see them, whatever day
Which
that
would
is.
be the,
Any Monday,
yeah.
any
Okay.
Monday, because you remember now it's 6 groups, so
yes,
whatever that Monday is. Yeah. Printed forms, we're gonna give you some forms that you need to print out. Once again, you can't run over to the library, it's not open. You have to bring those with you and be prepared. That's why it says be prepared on the left side. Be on duty, know your disease process, know your treatment, know your medication. Let me just get these 4 questions and then Ms. DeVoe is gonna go over the flow sheet, okay? Go ahead, Miss, who's this here? Miss Williams, go ahead. Chelsea, yeah.
Good morning, Dr. Adley. In reference to the PCR test, most institutions, the PCR test take 24 to 48 hours to process.
Yes,
With that being said, does that mean that we have to take the test Saturday and then in order to have the results for Monday, for that Monday morning?
so it's a PCR or antigen,
So if you're vaccinated, you need just the antigen?
yes.
Okay, but if you're not,
Yes.
then you need the PCR.
Yeah, the PCR, right, and you're correct with the PCR test. So the antigen goes with the vaccination. And the
That's fine.
PCR is 72, you are correct about that. They do take 72 hours. So that means those persons who are not vaccinated will do it on Saturday.
Thank you.
Uh-huh. Who's next there? That will be Ms. Brown.
Hi, good morning. Chelsea actually answered my question. I was going to
Okay.
ask the requirements between the PCR and antigen, but now I know vaccinated is antigen, unvaccinated is PCR.
That is correct. And I think the majority of you are vaccinated. When I did a poll, a lot of you said that you were vaccinated. Okay, let me stop sharing here for a moment. Go ahead, Ms. Sabo.
okay, I just want to say to you all that this is going to be very, very challenging, not only for you as students, but to Dr. Adley and I as faculty. We have had to agree to do something that I still am not sure at this point that we can do. To run the schedule as is, Dr. Adley and I have to agree to work the entire week, or at least 3 to 4 days out of the week, for which we are not required to do. And I really want to emphasize that. I am still at this point unsure if I am physically able to do what I have agreed to do. But this time is unprecedented. My heart goes out to all of you, and we will try to do what we can for you to get you out. So having said that, when you see me present myself over in that hospital under those conditions to try to get you out, I don't want any, I don't want to say I don't want any foolishness, because you all are not children. So I don't want to say that, but that is really what I mean. Just as we are agreeing to do what we are really not required to do to assist you, you're going to have to do what you probably never did before in your life. And that's probably work really hard, as these practicums are under the best of circumstances. So I want to talk to you about your clinical preparedness. In the past, pre-COVID, many times you come in the clinical area to students and they're not prepared. That has always been a source of problem for me, that you have provided students with the information that they need. You've given them the documents they need. You've given step-by-step instructions on what they ought to do. And when you get there and you say, can I have a report on the patient, please? They don't even know their patients. Please, please don't do so, please. I beseech you not to do so. Because as I said, I don't even know. I've told Dr. Adley this, I don't even know if under the best of circumstance, that I can do what I have agreed to do. And so if I have to come to you and you're not clinically prepared, imagine what that must feel like, because it's many of you and only Dr. Adley and myself. And what that must be, what that would be like for us to have to then go through that under the circumstances that we are. I am not prepared to do that. I just want to make that very clear up front. I'm not prepared to do that. I'm barely prepared to do what I've agreed to do. So having said that, the first thing I want, clinical preparedness. If you are unsure of what to do, please email me and ask me. You have to have the documents that we are providing. If we give them to you, we give them to you for a reason. And so we are trying to facilitate the practicum in a manner that we have not done before. So there are traditional assessments because we simply do not have the time frame to do them in the 6 days that you're going to be there. And so we have to find unique ways, or not necessarily unique, but just different ways of evaluating you to be able to capture some of the skills that you are required to do and for you to complete them in a reasonable manner in the time frame that you have. All right. And so I am going to then, Dr. Adley, have you allowed me to share?
Yes, yes.
All right. And so the first document that I want to show you is the clinical skills checklist. Just let me know when it's visible.
Yeah, you good. You good. Go ahead.
Okay. All right. So this is the clinical skills checklist. This is a checklist that we used to use prior to developing flow sheets for complex. And so what it sought to do is capture the skills that we deem to be competent or what we deem to be relevant skills that the student should know or should be able to complete in the time frame. Now, this was made for 7 labs over a 14-week period. Now we're trying, or 7 clinical visits in a 14-week period. And we're trying to do this now in 1 week. And so you're going to have to aggressively go after the skills that you have to do. You have to take that responsibility to complete the skills based on the areas that you are in. Because if you look at the flow sheet, the clinical skills checklist, it starts with flow sheet documentation, both in the ICU, you're not in the NICU now, but trauma, you're reporting. So getting the skills completed and getting it signed off by the person who supervised you is going to be of utmost importance. What we have added to it now is a rating by the nurse or the clinical preceptor or whoever is supervising you of rating your performance. And so there are several skills, and you may look at this and say, this is a whole lot to do in 6 weeks. I mean, in 6 sessions, a whole lot to do in 6 sessions. And it means that you are going to have to be focused on what you have yet to accomplish and go after them. Let the nurse that that is supervising you know, okay, I haven't done triaging yet. Let me go and triage a person, or let me go in the triaging room. I haven't done this yet. I haven't drawn an arterial blood gas. Can I draw it? That kind of thing, going aggressively after it. Now, we are aware that there are certain skills that you simply may not see. You may be in the emergency room and there is no resuscitation. Thankfully, there's no resuscitation, right? And so we will look at the checklist and determine those core skills that there should be no reason that you are unable to accomplish it. And then thereafter, those secondary skills would be, if you are able to accomplish them, good. And if you're not able to accomplish them, then it will do so at some other time in the future. Is that, everybody understands that? Any questions on that before I leave that?
No, ma'am.
All right. Again, I see your hand, Gray, just hold a minute. For example, things like CBP setup and management. And yes, this checklist is to be completed. Both the skills can be acquired from both the ICU and the emergency room. Don't save any skills. Okay, when I get there, I'm going to do that. Or when I get there, if the skills are available, accomplish them. And as you see, you only have the week to do it. Go ahead, Gray.
Oh, I was asking, maybe is that
I missed that.
Her computer probably dragging.
Yeah.
But let me just add something there, Mr. Vo. Just say for example,
but it's sort of like the rating is sort of 10 or something. The key is at the bottom.
We will give you the legend. The legend will be on the bottom of your form, of your checklist. And so it's not you rating yourself. It's the supervisor rating you. And so the legend will be at the bottom for them to drop in a number for you. for each of the skills that they have supervised you in. Yes?
Yeah, she said, okay, I think her
Okay.
computer is still on. Yeah, I just wanted to add that it's imperative that you complete all the skills on this form. And like Ms. Will said, you may not be able to do it, but at any given point, Mr. Bo and myself may just ask you to verbalize ABG analysis. So it's incumbent on you that you know the steps, verbs so that you can
Yes.
verbalize it and still get the points if deemed necessary.
Or let's say that your patient had an arterial blood gas, but it was not drawn on your shift. We may ask you for an interpretation.
Yeah.
Yeah, so it is going to be very, very interactive because we don't know the type of patients that you will have. We don't know the situation that you will meet when you get there. And so knowing the information, so the checklist shows you the skills that you are required to know. Yes? And so you have already completed complex theory, right? And
Yeah.
so, yes, so these are the skills that you would have been taught and know that you are required to know during that time. And so you need to dust off your critical care book and you need to, and your fundamentals, because many of these are also fundamental skills that you have to refresh yourself on those skills. Understood? I'll move on if I don't hear someone with a question. Let me see if I could go to the next document. All right, so let's take the first flow sheet. And again, these will all be made available to you, but based on the situation, we are still tweaking the information that we have. So this is a typical flow sheet that would have used between the ICU and the NICU previously. And so this is the flow sheet that you will use in ICU for your 3 rotations. All right. Now you are required, you may practice as many flow sheet documentation that you want, but you will be required to submit 1 flow sheet for grading. I am strongly recommending to you that by your 2nd rotation that you have completed a flow sheet for submission. Do not wait until the last allocation. And in fact, for the students that I supervise, I'm collecting them the 2nd rotation. Because if you wait until the last rotation, it means that I will have to wait to the end of your shift to get that flow sheet that you have completed because you're not taking it home. All right. And so you can do it the 1st or 2nd rotation to be completed. It's not a continuation. I just want to make that clear. It's not a continuation. This is a flow sheet for 1 day. And so let's say that you take the 1st allocation to the ICU, if you're going to the ICU first, and you want to use that flow sheet for practice. You want to do the 1st one as practice. You've never documented on it before, and you want to practice. So you take that one as a practice one. The 2nd allocation, you go, that one is for submission. All right? Yes?
Yes, ma'am.
Okay.
Yes,
Let
ma'am.
me just add something, Mr. DeVoe.
Mhm.
In practicing, we are looking in particularly at your interventions, and you would have gone over this from the beginning of the nursing school. If you do not understand it, please make every opportunity to speak to myself or Mr. DeVoe. Assessment is a part of the intervention, yes, but you should include an assessment. You should include your therapeutic intervention, something that the doctor would have ordered, like you're administering a medication, something therapeutic that the nurse would have done, which does not require a physician's order, and collaboration / education. So those 3 components must be in your intervention. So if you have assess straight down, that means you did nothing for the day. Okay, so you need to have your assessments, your therapeutic interventions, dependent and independent, and your educational component in those areas and to be evaluated. So goal met is yes, but this is ICU now. This is complex. Goal met, and how was it met? Say what happened. Patient verbalized understanding of therapeutic drug intervention. You need to state what happened when you evaluate. You have to evaluate that goal. That's what it means. Goal met is just a statement. All right.
Yes.
Go ahead, Mr. Vaughn.
Burroughs, I saw Burroughs' hand up.
Go ahead,
Kevin.
Burroughs.
So this flow sheet that we have, we would carry out doing it like we did care plans. Are we picking the patient? Are they being assigned to us?
They're not, well, in my regard, they're not being assigned. When you go in the clinical area, you will be assigned a patient,
Okay.
right? This is for the ICU.
Mhm.
So we will not have an allocation there for you. That will require us to go there prior. So you will get your assignment from the ward, from the ICU, or from the area that you're going to be in the emergency room. All right. And so, as I say, the flow sheet is for 1 day. So it isn't like you started on Monday on a patient and then you complete it on Tuesday and Wednesday or something like that. Yes? Okay.
Yes, ma'am.
Yes. And so if you are unfamiliar with, you shouldn't be unfamiliar with it if you've completed complex, but if you are unfamiliar with it, it is accompanied by a physical assessment tool. And so you will complete your physical assessment on the patient. We may not ask you for your physical assessment tool that you have completed, but we may ask you for the tool just to ensure that you have completed the physical assessment. Based on the physical assessment, you will determine nursing diagnoses for the patient. You want to write at least 5 nursing diagnoses, right? But the first and second diagnoses of highest priority is what is placed in this area here and in this area here. So there is no space for you to write out completely the 5 nursing diagnoses. You will just log them here in order of priority. But priority number 1 and priority number 2 is what we're going to evaluate you on. Yes?
Yes.
Okay, all right. Now, there is still some discussion in my, or some pondering in my mind, because there is some repetition between the checklist and the flow sheet. I may seek to eliminate that or just not concern myself with it. Because remember now, we used the checklist before we developed the flow sheet. So when we had the checklist of all the skills, we did not have a flow sheet at that time. And so when I developed the flow sheet, it was to try to make it as comprehensive as is the ICU, the existing ICU flow sheet, just our version of it to capture the kinds of things that you will be documenting. So here it has medication administration that the nurse would countersign that you administered, some additional care that you provided. And then this would be the actual flow sheet part of it, of your Glasgow Coma scale, your ventilation, your hemodynamic monitoring, ECG, shift fluid, and nurse's notes. Now, what we can do, and what Dr. Adley and I have talked about, is simply focusing on the nursing care plan part of it, this part here and that part here, and allow you to fill out the flow sheet area. But we will be grading the care plan aspect of it. The rest of the information is to assist us in grading, to know that the nursing diagnoses that you have selected, the interventions that you are completed are correct and valid for the nursing diagnosis that you have identified, because you still have your checklist to do. That makes sense? Everybody is with me with that?
I think Watson, Watson, go ahead, Watson.
Hi, please forgive me. I came a few minutes late. My first question is this recording going to be placed up on Zoom? I mean, not Zoom, on Moodle?
It
Dr. Adley will have to tell you
will
that.
be placed on Moodle, but you may not be in that class. I know those persons who are in my class, and I could share it with you, Miss. Well, you should have a
Share,
this thing.
Dr. Ali, so we can refer, I'm begging.
Yes,
My next question is, how many students will be per allocation per ICU as well as in A&E?
We're going over that at the end of this session.
Yes.
Okay, all right, thank you.
As far as I'm aware from Dr. Campbell, they are supposed to create a dedicated Moodle page for this course.
Okay.
That's what
all
I'm
right.
to understand.
Okay.
So that we can put the shared documents there for those, because it would make sense for those who are registered in the, but then that might be different. Anyway, there must maybe some internal things, whether they actually registered.
Okay. If he did that, then I
discussed
will
it.
post there.
Yeah, we discussed it. I'm not sure. I'm not sure how it's going to be done. Again, we have to be very open. We are playing this by ear. And so we will share it to you the best way we can. And then we'll commit to that, sharing it with you the best way we can. All right?
Deja, go ahead.
My question is, Mr. Vogt, is it one for submission, the entire cost for the care plan, or is it one per area that you're in?
One per area. So it would be the ICU flow sheet, the emergency room trauma flow sheet, and the checklist.
Okay, thank you.
Yes, okay. Is that your hand still raised, Deja? Is that someone else?
Is it?
All right. Again, print the flow sheet. When we make it available to you, practice it or writing on it before your allocation begins. That's what I always recommend that students do. All right. You screenshot it, you send it to me, ask me to have a look at it. What in that regard, right? I should take that back because I don't imagine that 120 people will be sending me. Just practice, practice. Writing on the flow sheet it's much more challenging than it looks. Writing on it, all right?
Mhm.
Collecting your ECG strip, adhering it here and interpreting it up top. Nurses' notes down to the bottom. Even just writing in this nursing notes area is very challenging, all right? Brown. And then after that, I will go on to just to familiarize yourself with where the information is.
Okay.
Go ahead, Brown.
Okay, that's what I was going to ask you, if you would be able to go over the flow sheet document with us when we see you on ward.
Well, I don't want to go over it when I see you on ward.
This is
I
now.
want you to know what to do with it before you get on ward.
Mhm.
So-
You have been,
No.
let me just recommend something to you, to all of you. You've been on the clinical, in the clinical area many times before. You've collected significant amount of patient information in the time that you have been a student here. Take some of that patient information and start entering it into the flow sheet so that you are familiar with where things go. When I come to you on Monday, the whatever, I will have to look at the thing. I don't want to come, can you tell me how to do the flow sheet? No. You print the flow sheet when we make it available to you and you start writing in it. You're making mistakes. You emailing me and ask me some questions, that kind of thing. All right? Because everything is labeled on where it's supposed to be. If it says ET tube or tracheostomy, if the patient has an ET tube, you circle it. You put in the oxygen or the FiO2 in here, the times. Yes? And so it tells you where everything should go. And so practice it, ask your questions before you begin. So you have this weekend, Tuesday, Wednesday of next week, because of midterm, you have time to do that, all right?
Okay, Mr. Vo, before you go on, okay, so just how you say to practice in the areas, right? So
Yes.
where your arrow is pointing for abnormal lab results,
Yes,
there's a slash there. What do we put
Yes.
to the top? What do we put to the bottom? So we know.
okay. Let's
Because I know
say,
sometimes you won't put dates and whatever, so.
no, let's say that your abnormal result was potassium. Yes? What's normal
Yes, I'm-
potassium?
3.5.
3.5 to 5.5.
Five, or some says 5.0. So let's say your potassium is 2.8.
Got
You put
it.
potassium, that should be a plus sign, eh? So I
K
put it
plus.
there. Yes,
Alrighty.
2.8. That's so you only log in your, remember now, this is a Word document, 2 sheets. How do we get as much of a traditional flow sheet in a Word document? You see? So we don't have space for everything. Even when you put in your times, look at your ventilator settings that says time. You see where my time is?
Yes.
What you want to do is spread that over your shift because you have 3 spaces. Let's say I was working the 8 a.m. shift. I would make my first documentation by 8:30, depending on report and all of that. The first documentation as early as I can, I would put, let's say 8:35. Let's say I write that 8:35, and I put the 8:35 in this spot right here. Around about, unless there are no additional instability in the patient, the next documentation I would want to make around 12. And the next one before I leave my shift. You understand that?
Yes, ma'am.
Okay.
Can you go over to the IV fluids?
An IV fluids. So let's say your patient has D5 with dopamine. That's what you would put in that box there. Now, let's look at the next box that have, so let's say your dopamine is going at 5 mites 5 mils. Yes? So you would put 5,
No problem.
close your mic for me, please, right? So if the patient had the dopamine in progress, this would be 5, that would be 10. You see that?
Okay.
And then the next
Alright.
one would be 15, and then in the end, you would bring your totals to the end. So if you continue that, let's say at the end of your shift, your patient had a total of 10, 20, let's say they had a total of 30 mils, 30 mites, 30 mils. You would bring your totals to the end because your totals now go down here with all of the intakes. They might have had NG feeds. Yes, may have had Glucerna at 20 mils an hour. So out of the corner, you will take all your totals, shift intake and output, the total intake, the total output, and the balance, whether positive or negative. All right. So I'm not saying that I'm not going to be there in the clinical area to assist you. That's not what I'm saying. If you are having challenge, okay, how do I, I'm not here there to familiarize you with the form and you see me reach there on Monday.
Could you
Or
put
not
that
Monday,
paper
on
up one more
Tuesday.
time, please, Mr. Vo?
Say that again.
Pardon.
I didn't get the question.
Could you put that paper up one more time for me, please?
What I was
Be
writing
quietly-
on?
Yes, ma'am. One
What,
second,
you mean?
girls, 1 second. Yes,
Okay,
ma'am, the
I
paper is
can-
writing on.
Okay, I continued it. I'm used to doing this for
Lower
my
it down,
pharmacology.
lower it. Okay,
There?
good. Okay, right there. So you put the potassium, okay, good. All right, thank you.
Yes, whatever your normal, it might have been sodium. Na, it might have been sodium. And the sodium, 123. Yeah, let's see. So whatever your abnormal values were. Or there may be none. So there's nothing to put in there. You see what I'm saying?
Or better yet, the potassium, the sodium may have been 100. Right?
Mm-hmm.
Now, what's next, Ms. Archer? What happens next if your sodium is 100? See, that's the question. You could document as much as you want.
Yeah.
But you need
But
to
that in
understand.
our,
Yes, you need to understand that a sodium level of 100, that patient is at risk for seizure. So that means our discussion is going to be on seizure
the
precautions.
protocols, yes.
Okay, if that potassium is 6 or 7, what does that
Cardiac
mean?
arrest.
That
Yeah,
means
so
we need to, yeah. So
Yes.
documenting is one thing, but understanding what you're documenting is another thing.
and that is our purpose for being there with you, to elicit this information from you. So that's why I'm saying familiarize yourself. You don't want to be getting familiarized with your form the day you are in the clinical area. That's not going to work well for you. And so you will be given it in sufficient time to print it, practice writing it, document on it. Yes? Now, someone was asking me one last question. Did I hear some? Oh, I already answered that, Heron.
Yeah.
Did I already answer your question?
Yes. You showed
Okay.
Yes, ma'am.
Lightborn, go ahead.
Good afternoon, Mr. Vo. Will
Good
the flow
afternoon.
sheet for ICU be the same as the flow sheet for trauma room?
No, the flow sheet for ICU is not the same as the flow sheet for trauma. So I will go over that if I am concluded on this one. Is this concluded? Is there any more questions on this flow sheet here? Okay, and so the flow sheet for trauma says emergency, all right? The emergency flow sheet. So this is the emergency room flow sheet, and it allows you to document. Actually, I did make some changes to this one, but you will get the final one because I did include your student, allow you to put your student number and make 1 or 2 slight corrections to it, all right? But you will get, remember, you will get the final documents. They will be sent to you or posted for you in a Moodle page. And so this now allows you to document more than one patient, all right? So this is patient number one, so it's repeated. It's the same thing repeated. So this would be, because in the emergency room, you're seeing different patients, right? Yes? No matter where you are, if you are on the floor, if you are in trauma, you're in chest pain, you're seeing more than one patient. Yes. So this allows you to document 4 patients. 1, 2, 3, and 4. When you print your documents, try to back your documents if you can. It makes it much easier. All right. And landscape rather than portrait. It makes it easier for documentation. If you put this in an 8.5 by 11, it's going to be very difficult for you to write in it. You can, but it's going to be difficult. So if you can put it on in landscape long paper, that would be better for you. And it's the same kind of thing of familiarizing yourself. Write some information and make up some information and write it into practice. Patient initial, the age, time of admission, mechanism of injury or illness. Then it is the patient on oxygen. You just tick it. You put whatever liters per minute, nasal cannula, non-rebreathing, ambu-buying the patient. You just tick it. And that's what I tried to do with this with this flow sheet, is to make it as much of tickable as possible, to be easier to document on. Airway, just tick what it is. Oral, nasal, NG tube, long sound, just put a short statement. All right, adventitious or bronchoseccular, you see the neuro observation, level of consciousness, is the patient conscious, unconscious, with the Glasgow Coma Scale, put some vital signs in there. Assess the pupils if they're required. The patient is fully conscious and orientated, then a pupil size and reaction is not necessary. Is there a cervical collar? Yes, no. So you need to know where the information is, right? Cardiovascular, whether there's chest pain, especially for the people who would be in chest pain. Now, I'm not sure if they are going to put you in an area and leave you in that area, because when I developed it, it was for students to transition through the emergency room, start in trauma, then spend 2 hours in trauma, go to the floor, spend another 2 hours there, and then end up in the trauma area or in the chest pain area. That's what was the intent. So if they assign you to triage and leave you there, I hope that does not happen. But again, we are there at the behest of the hospital, and we have to do what they ask us to do. You put some nurses' notes. Don't take up the entire nurses' notes at the beginning of the shift, because you always want to end your shift with an end of shift documentation. I always tell students it's how you left the patient for legal reasons, right? Whatever diagnostics are done, you just tick them, put in whatever results that you have. And so it's the same thing repeated 4 times. We would love for you to document 4 patients. That is the goal. We would like that to be the case. All right. Questions?
Francois.
Francois?
Hi, good afternoon. I know you said, at least it was mentioned earlier, that the library won't be open for printing. Is there any update if the labs will be open for us to print?
I can't say.
I
have no idea. No idea whatsoever.
I doubt it.
So
Okay.
don't plan for that. Print
Yes,
at John Bull, just like all of us.
Yeah, okay.
For 25 cents. And
I think copycat is cheaper.
Oh, okay, but that's so far. I mean, far compared to me, where I am, you see? So,
Yeah.
but wherever you are, but listen, print enough for your allocation. Print for some practice. So don't go there printing 2 sheets.
Yes, ma'am.
Yes.
Yes,
And
ma'am.
also, this may seem to go without saying, but I'm gonna say it anyway. You must consider these flow sheets when they're given to you as legal documents. Yes? Close your microphone then, Francois, that's you still open. Yes, you must consider these to be legal documents. And so the principles of documentation obtain. Black ink only. Black ink, no other kinds of ink, no other kinds of writing tools used on this. No liquid, don't even take it across the threshold, please. So you must see these documents that we are giving you as if you were using the documents in the hospital itself. That was the reason why the flow sheet was developed, because the areas didn't really want the students to be writing on their flow sheet, which is valid. So we give you your own flow sheet that mimics as best we can what the ICU and the emergency room flow sheet is. Yes? So practice writing on it is all I'm saying. One day, we'll make it, Dr. Hadley, one day, we'll make it so you could fill it in.
No, but guess
Uh,
what? I actually started it, you know, but I got lazy.
Yeah, 'cause
I
you-
actually
that
did.
you are
Yeah,
more, yeah,
yeah,
I can murder Word
yeah,
and Photoshop and that
Yeah.
kind of thing, or Corel Draw.
yes.
But that interactive one, that's not my skill. I can
Yeah,
tell you what
I
should be on
started
the
it.
form,
Mhm.
but to make it interactive, I'll have to do some course on Skillshare or something. like
Yeah,
that.
yeah, I did
All
it.
right.
Yeah,
So as I say, one day, it'll be like that. All right.
okay, so let
So I
me,
can stop share now.
yeah,
so
yeah,
that-
let
yeah.
me. So here we go. Okay, so just to
Just make sure
reiterate,
we get these.
are we,
Mhm, go ahead.
am I showing? Can you
Yeah.
see? Okay, good. So PCR, that's where we were. Okay, this is where you were. Okay, so this is just recapping what Mrs. DeVoe said. Email faculty if you need to reach out. Complete your forms in a reasonable manner. You're gonna have a skills checklist that you will get a copy of. You're to print and complete, have it signed off. You're gonna have a rating performance, and you may be asked to verbalize some of those skills that you were not able to complete physically. You're to complete the flow sheet for ICU and ER. You're also going to have a physical assessment tool that accompanies each of them. You are to print a minimum of 6 sheets because you're going to be there for 6 days. Landscape if possible, and 1 for grading in each of the areas. So you'll have 1 for ICU and 1 for the emergency room. Remember to use black ink. No, I know you're, I know some of y'all don't know what liquid paper is. They don't use that anymore. No liquid paper.
Sorry,
Hide-
correction fluid.
Yes, the correction fluid.
Yeah.
Hide
yeah.
the patient identity. Remember, this is confidential information, so we don't want, if you're going to use
Patient initial for me, please.
Yes, and of course, practice writing on your flow sheet. So once again, just be prepared. Ms. DeVoe went over the document. We talked about the potassium. We talked about sodium. Documenting a patient death is not what I'm there to see. I need you to interpret what's happening. Those who would have taken my class before would have remembered this slide. Unless you can understand PaO2 or 40 millimol of mercury. Listen, if you've forgotten, go back, find out what the normal range is for PaO2. That's low, isn't it? If the patient FiO2 is 100%, remember, if a patient at FiO2 is high at F100%, I mean the patient is not compensating. This patient is in a serious position. PEEP of 18, this patient is high. That means the alveoli are not diffusing oxygen. So that's high. What type of patients are normally like this? You have your patients with ARDS, COVID-19, you're gonna see that in the area. Okay, we're gonna try not to have you on with patients that do have that COVID-19, but you may have a patient who have another type of inflammatory process going on there. All right, so the peak is high. The alveoli is collapsing, so we need to keep it high. Tidal volume is low, 500. Why do we have it at 300? All right, that lung is very, very sick. Peak pressure of 30. If you are forgetting this information, this is a good time for you to know and go over, because, you know, normally my assessment stops right there. If I ask the question, what is this patient PEEP and what does it mean? You don't know the answer. There's nothing else to discuss. So please, let's have a discussion while we're there. Prone position versus, you know, a patient who's in prone position for respiratory disorders versus prone position for head injury. Okay, why would you not want your patient to be in a prone position with increased intracranial pressure? All right, because that's what it does. It increases intracranial pressure. Ms. DeVoe also had on that sheet, she spoke about oxygen capacity. All right, note that nasal cannula maximum is 6 liters. Do not put on that form the patient has 9 liters of oxygen. All right, 9 liters of oxygen means that patient is either on an oxygen face mask and he or she is getting 60% FiO2, and that is how it's documented. A patient that is getting 7 liters of oxygen is not getting 7 liters of oxygen via nasal cannula, maximum is 6. So therefore, that patient's getting between 35 and 75% of FiO2 oxygen, all right? That's how it's documented. Another thing, you're going to be dealing with mannitol. This happens all the time. Mr. Bo, I don't know if it happens with you. When I'm in ICU, those students do this all the time. The patient's getting 15, 20, 25% of mannitol. You need to understand your mannitol is going to be there. You're going to meet mannitol. Learn it, learn about it. It causes hypotension. Therefore, the first thing I'm going to ask you what the patient blood pressure is. I'm asking that for a reason, because that's what it causes. It depletes the patient's volume. Do not administer more over 50. I shouldn't have to tell you this, because on this slide here, on this one here, I said you need to know your disease process, your treatment, and your medication. All right? So be prepared. I like this slide here. That looks good. All right.
Dr. Adley, I also wanted to interject, since you was on the mannitol sheet, is the hypertonic saline.
Yes.
ICU is using more, trying to move more to hypertonic saline than mannitol. I mean, mannitol is still being used, but also to know that that's a part that can be included as a part of treatment as well.
Absolutely. But what happens is the students take it from past experience. Students, I'm telling you this, they take it as if they're just administering antibiotics, you know, and they treat it as if they're doing that. But the next question is, what is this patient, what osmolarity level? Because mannitol increases osmolarity. So you want an optimal of 300 to 320. So there's some things in there. Monitor the serum osmolarity, because that's going to be the question every 4 to 6 hours. Ensure that it remains less than 320. And what does it mean when you have all of this serum osmolarity? That means all your potassium, sodium, everything is going to increase. Monitor the urine output. So if I say, what are we doing today? We're going to administer mannitol. So you already know that you're going to monitor the blood pressure. You already know you're going to monitor that intake and output. You know that you're going to check your lab level. Remember, hyponatremia. So there it is. You put on there sodium, you put your little slash and you put 109. Can cause seizures. Hypokalemia can cause dysrhythmia. And that happens when you administer this mannitol. All right. One last thing, your barbiturates. Okay, know why the patient is on it. Know that if it's used to have the patient sedated, to decrease ICP, why is this patient on this medication? Okay, what are some of the things you're going to be looking for in that regard? So don't just look at it as if you just given a medication. You're going to have all those steps involved. All right. And I think that will conclude that information.
Dr. Adley, one last thing.
Yes,
remember now, things pop into my head from you put your slides, just to make things easier for the students. In your complex 411, you would have we would have covered critical care pharmacology, and we would have talked about the drug protocols. There are drug protocols in the ICU that you're going to have to know. We have alluded to some already. Dopamine is a protocol, and you would have covered that in 411. I will say that with confidence because it is on the course. So you would have covered dopamine, things like nitroglycerin protocol, epinephrine, and the sedative hypnotics. And so the most common sedative hypnotics that is used in the ICU right now is Dormicum, fentanyl, midazolam, those kinds of. So if these are what drugs that are commonly used, you may as well learn the protocols. And so when you learn the protocols, a part of that is your nursing assessment and your nursing responsibility. So it tells you what you must monitor, what are those hemodynamics that you're supposed to be monitoring, and what are the protocols under which you should give the drug. You can't give it unless the systolic blood pressure is greater than 90 millimeters of mercury, things like that. And so go back to 411 to go review your drug protocols. It'll make your life so much easier.
Yes. Go ahead, Ms. Curry.
Good afternoon, Dr. Adley and Mr. Bo. I hope you guys are doing well. So I'm just asking about a confirmation on something that would have been stated. So for students that are unvaccinated, it has been said that they require a PCR to enter the clinical area, because currently, as it states, most classes only require antigens for students. So is this something that Complex is doing particularly, or how's that working?
What is the protocol for the University of Bahamas?
So the protocol for the university is that all students will be required to get an antigen test to go
Okay.
into the clinical area or on
No,
the
the
campus.
university itself.
Antigen test.
Okay,
And if you're not,
I'll follow up with Mr. Campbell right now because
alrighty,
he was saying that with the you remember now we are with the PHA and I have to go with what they're saying.
correct.
Okay, while we're going through this, I'll call him right now.
Thank you.
That's Curry. Anybody else? Okay, so let me let's look at the schedule. This is Google. Yahoo. I had it open up earlier, but I lost it on my screen, so I'll have to go back. I think that was it there. There we go. Okay, revised schedule right here. Okay, who was that? Who said their name? Who said they're in Miss Jolly class? Who was that? Who I was talking to earlier?
That was Sharif from Ashby.
Okay, down. Okay, so this is the this sheet would have been
Dr.
going
Adley,
around.
I just want to let you know it's 12:06, eh?
Yeah. This we finished now. I just want to go over this real quickly.
Just so I know you have a class.
Yes, I just inboxed them for 12:30. We have a let me see if this is the new one. Is it?
Click on number one.
Yeah,
Yes.
okay, number one.
Yes.
Yeah, this is the new one.
Yes.
Okay, so classes actually starts October 18th. Apparently, next week, Monday is the national holiday, and then the university closes Thursday and Friday. So therefore, we were hoping that we were going to start next week, but we are unable to start next week. So we'll be starting the following week. All right, so we start exactly with, if you look here at group number 1, that's on the screen, you would notice that Kalisa Newton is in a group with a group of 7 students, Kalisa down to Bridgewater. If you look here at the top, it says A&E/ICU. Whatever you see in the front, that's where you'll be going for the first 3 days. And then when you look at the back part of it, whatever you see in the front is where you'll be going for the first 3 days. That's it. So here, for example, early, she will be going to A&E for the early, and then late, she'll be going to ICU, like that, okay? So this group of 7, Kalisa, Brown, and Sawyer will be going to accident emergency room on the early shift. And if you look here at the bottom, you have Grace, Low, and Raming, is it there? Will be going to ICU on, is that right? That's right, Lindell?
No, so they would be on the late shift in the emergency
Oh, that same
room.
in the emergency
On the
room.
same
Okay,
day.
yes, on the
Yes,
same
on
day.
the same
Yes,
day.
on the same
Yes.
day. Okay, so
Yeah.
it's whatever comes first. Yes.
Yes, whatever comes first.
Yeah, so they'll be going to ICU on the same day. All right. So A&E, that's the same A. Oh, so let me do the A&E. Kalisa, Brown, and Sawyer, A&E, Monday, Tuesday, Wednesday in the morning. Grace, Low, and Raming, they'll be going to A&E in the evening. That is correct. Okay, we got it. Then it switches over.
Good afternoon, Dr. Adley. I have a question.
Okay, Ms. Barr.
Oh, sorry to disturb you. I know on the schedule, I see that I'm scheduled for the 18th. I wanted to know if that was running simultaneously with management because we have the same schedule.
No, this is why it took so long for Mr. Dr. Campbell to pull this out, because he went through it and he knows that you're supposed to be in management, and he was to ensure that you're not doing management and 411 at the same time.
Okay, but that's the thing. I'm on the schedule now, and that's the week that I have management.
On the 18th?
Yes, ma'am.
Okay, well, please make a note to him, because I'm
Yes,
going,
ma'am.
I can't change anything.
Yeah, in fact, everybody who may notice, I know you can if you notice
Yeah,
that you are
screenshot, yeah.
clashing with something, do that now to facilitate Dr. Campbell, because this is not an easy thing at all.
Yeah.
All right.
Thank you.
So anybody else noting a clash?
Yeah, I'm
Please
gonna
let us
switch.
know now.
I'm gonna switch over. So here somebody asks about the second ICP. It's showing the 13th day and evening, and then yesterday was it was 2. All right, so let's go over to the second group. And here you have the second group. Could you see it? It's a little bit font, but you could see it here. So the second group, is group 6, 7. Now, if you notice this week 8 and 9, there's nothing here. Okay, we have other students who will be putting on those dates. But we do have a last group of students here with Kalia Jones, Stubbs, Stewart. You will be going on December 6 through 11.
I'm sorry, Dr. Adley, can you zoom in just a little bit more, please?
Okay, let me see. I don't know why this is so like this. Let me go over there. That's better. Yeah.
Yes, ma'am.
So you could screenshot that. Okay. Did you who was that? Who said it? Bridgewater? Who said they didn't see themselves? Bridgewater?
Sharifa McPhee. I don't see my name there.
What's your last name?
McPhee.
Oh, McPhee. I thought I saw a McPhee on the other screen.
Just Juvo.
Okay, so that you'll have to reach out to Mr. Campbell on that. Yeah, okay, that's Juva McPhee, yeah.
So whoever, Dr. Adley, good afternoon.
Yes.
So once you don't see your name on the list, just contact Dr. Campbell, is what you're saying?
Yeah, because
chances are we'll be in those blank spots, the 8 and 9.
No, that what? No, that's for something else.
The best thing to do is contact Dr.
Call him.
Yeah, Dr. Campbell. It's
Dr.
better to do
Adderley,
so.
Dr. Adderley, what I have noticed is that Miss Jolly's section students' names are not there.
Okay, well, I don't know what's happening with that. I couldn't explain. So, Charles, you in Miss Jolly's class as well?
Yes, ma'am.
He is.
Okay.
I am as well.
Okay.
Me too.
I'm also in Miss Charlie's class.
And you don't see it there?
Me too.
No, I don't see my name.
Okay. Okay. So please reach out to Mr. Campbell. Probably if you have one of you, just do that so you want inundate him and he can answer.
And just put all the names.
Yeah, put all
I think he may know the names. He may know the names.
You know what? I'm supposed to call him right now. Yeah, I'll ask him about this PCR and then I can ask him about that.
Thank you so much.
Go ahead. Who's that? Mark Watson?
Yes, sorry to disturb again. For week 6, is that November 8th to the 13th for clarification, right? For group 4, that's November 8th to 13th?
Yeah. Uh-huh.
Okay, great. All right, thank you. Okay.
Dr. Adley, go to the first screen for me, please. The first first weeks.
That's good. Doctor.
Yeah, we are still doing me 357, right?
Yes. 3. Yeah. Odd. Yeah. Actually, you said so I'm going to odd then.
I was wondering if we finally made a decision.
Yeah.
So I'm doing 4, 8, and what's the other one? Try and roll over, because did I see a week 10?
No, that's, you remember, that'll be 10 right here.
Okay,
the
so
60
4,
level.
8, 4, 8, and 10.
Yes.
Okay. All right, so that what Dr. Adi and I are talking about is the weeks. As I indicated to you all from the very beginning, it's only 2 of us. Miss Roll will come, Anna Speed Roll will come on a Saturday.
Yes.
And that's still to be organized, how that will be done. And so since there are morning shifts and afternoon shifts, Dr. Adley and I can't work 16 hours per day. So even though you're there for the week, we can't be there for the week. And so there are going to be days when we can be there, and we have to try and strategize number of hours. Close your microphone, please. The number of hours, and so that we can see the morning group and the afternoon group. Now, one strategy could be come the first part of the morning group for the morning people and the first part of the afternoon group for the afternoon people. That requires us to be in into the clinical area 2 different times.
Hold 1 second.
Yes. And so what I have proposed to do, which might work and may not work, so it's open to change, is that I lay across the 2 groups. So the latter part of the morning shift, and then the first part of the afternoon shift, and then try to reverse it like that. What are your suggestions on that? What are your views on that? Anybody who just raise your hand, and then I will ask you to unmute. Is that workable? Does that?
Was that question directed to us or directed to Dr.
Yes.
Adley?
No, to you all, to you all.
Repeat the question for me, please. Sorry.
Yes, okay. So what I'm saying is that you can see on a weekly basis that there will be a group in the morning and there will be a group on the late shift, right? Yes?
Yes, ma'am.
So it's only
Yes,
Dr.
ma'am.
Adley and myself. And so if I'm doing week 4, can we close the microphone, please? Oh,
That's why we couldn't hear you the first time.
Why couldn't you hear me the first time?
Say mic open.
Latavia, can you close your mic, please? Latavia.
You know, when I can't get people to close their microphone, I just put them out. I really can't deal with that, okay? I'm trying to explain something as well as trying to focus on who's talking incessantly in the background, okay? Now, let's start this again. And so what I was saying is that Dr. Adley will do weeks 3, 5, and 7, and I've consented to do 4, 8, and 10. And it really is a consent to do 4, 8, and 10, right? But each day, there will be a group of students in the morning shift or on the early shift and a group of students on the late shift. Now, I can't every day work a morning shift and a late shift to be able to supervise students. And so it means that I'm going to have to be on a part of the morning shift and a part of the late shift. As I say, I have agreed to this, but I still don't know if this is something that is workable. But as I said, I've agreed to consider it and to try it, all right? And so now, am I gonna go part of the late part of the early shift and the beginning part of the late shift? That is what I have proposed to do. And so if the early shift ends at 3 o'clock, is it 3 o'clock, right?
Yes, yes.
And so somewhere 11 to 3, and then on the late shift, 3 to 6, somewhere, that is what I am proposing, to see how that works, rather than me having to go the beginning of the morning shift and the beginning of the late shift, coming in and out of the clinical area in that way. So that is what I'm proposing.
Well, the proposal is just be prepared, that's all. Just be prepared.
Yes, whenever I arrive, yes.
Yeah.
Yes, but then it can slightly disadvantage the morning shift of not having someone there at the beginning of the shift.
Oh,
see?
yeah,
So-
sometimes I'll be there.
Yes.
That's why I said they need to be there.
Yes,
time.
I'm gonna try. The first week is gonna be rough,
Yeah,
but if I try that the first day and I see it does not work, then I would have to, that's why I'm saying I have to be flexible. You all gonna have to be extra flexible. All right?
mhm. Okay, you already answered those questions. I spoke to Mr.
I think
Campbell,
so.
a few minutes ago. He said the 8th and 9th week is proposed for Ms. Jolly's group. That's not yet determined, so please, wait on him to let you know when that is gonna happen. And it is the PCR within 20, sorry, not PCR, it's the antigen within 24 hours. So it could be the morning off, it could be the day before, but it needs to be within the 24-hour period for the antigen. Okay, so Ms. McPhee, Ms. Williams, and Ms. Barr, you ready? I've got your questions answered?
Yes, ma'am. No,
Okay.
ma'am, I have a cry because Dr. Adderley, it's not fair to us students for some of the lecturers to get on board and then just one lecturer holding out a class of students. It's like, we don't have nobody to cry to.
No, I'm sorry, but we cannot address that in this meeting. I can sympathize with what you're saying. My heart goes out to, but we are all trying to do what we can do within the confines of the industrial agreement of the university, all right? And so Dr. Campbell is trying his best to see how he can facilitate. Nothing in this is normal.
No.
And so getting up in arms about what's not fair and all of that, just settle down is all I am saying. Settle down and know that we will try the best that we can do to facilitate what we are doing. Because if we start to take hard lines, this is not going to work.
No, it's not.
From a faculty perspective, because Dr. Adley knows what is dripping to fall out of my mouth.
I know.
Okay? Yeah. So don't do it, please. That's what I am saying.
And please, groups, be prepared, because remember, this is hard for all of us. This is hard for all of us. I don't work at the Princess Margaret Hospital. I work at the University of Bahamas, and there's no COVID over there. I'm walking into an environment where there's COVID, and we're doing this to facilitate you guys. So please be prepared. That's all I could ask. That's all I could ask. Be prepared.
And know that we are doing our best.
Yeah.
Even if something doesn't work out, it didn't work out not because we didn't do our best. And so we're not going to leave students hanging out there without some ability to complete the course. So we will do our best. All right. So those students who are in other sections and you're not sure what's going to happen, just relax and take some deep breaths. It will work out. I believe
and that's
will.
all the way. That's all the way in November. So you guys have a chance. Okay.
Yes. Go study your work. Practice your flow sheet. Download it. Practice it from now. All of those things that you can be doing to get the best out of what we are attempting to do. All right.
Williams, and then I have to take the leave. Any questions, Williams? I see your hand.
Yes, ma'am.
Okay,
I
go
have
ahead.
2 questions.
Go
I just
ahead.
want to be clear. The first question is, we don't have any group projects.
No, remember,
do
this
we
is
have-
a clinical. This is a clinical.
I understand, but we have some group projects for management practice.
No, management calls for leadership and management skills, which include groups and discussions and so forth. So yeah, I can see that happening, but not here.
Okay.
Your skills checklist right now, go ahead and start reading up on how and watching videos and understanding your drug and pharmacology process and disease process and all those different things related to intensive care. Your
And
ventilator
skills.
settings and all that
Yes.
stuff. Yeah.
Okay.
Yeah.
And the other question is, just to be clear, we need a rapid antigen test 24 hours for each day of the week, or just at the beginning of that week?
Just for the beginning.
Okay, thank you.
Okay, Ms. McPhee?
No, that was an old hand.
Dr. Adley, you're gonna send this tomorrow, you said?
No, well, yeah, this, I hope that you screenshot it, because the person, remember now, we don't start until the 18th. So that gives me time to make sure that everything is okay with this with Mr. Campbell. Mr. Vo is gonna fine tune those documents and hopefully they
Yes.
put together one Moodle
Yes, that's what I'm
page
hopeful
so we
of.
can just put everything on there one time.
Yes, and the students could access
Yeah.
the forms rather
Yeah.
than us trying to email the forms out to you. But there are still some tweaking that needs to be done. I'm trying to make it as efficient as I can and try to eliminate duplication as best as I can. And then I
Okay,
will
thank
send
you.
it out.
Thank you very much.
Okay, all right.
Go ahead, Grace.
Well, in relation to the Moodle page, they were able to do it for management, so hopefully they're able to get that done for complex as well.
Okay.
Also in relation to the clinical skills checklist, is it due at the end of our rotation or is it due the following Monday? How will that be set up?
No, this is what I propose. As I said, for those groups, because Dr. Adley is free to be flexible how she wishes in that regard. But for those groups that I am supervising, I am collecting your flow sheets on your second allocation for whichever area you're in. The checklist, I'm going to ask Ms. Roll to collect on the Saturday, which gives you the entire week to complete it. Yes?
Okay, yes, ma'am. Thank you.
Yes, that's what I'm proposing, but there's no taking home of anything. Now, the flow sheet, you will, not the flow sheet, the checklist, you will continue, you will take, or you will bring back and all of that. Because you're doing it over the entire week. I want to give you the full week to be able to acquire any skills that might be outstanding, that kind of thing.
Yes,
As best as
that
you
was
can.
my question. Sorry, Mr. Wu, that was my question right there. That checklist is to be done over the entire week.
Yes, the entire week. So I'm gonna give you the 11th hour to be able to submit it, which would
Okay,
be
I
the
understand.
Saturday. Yes?
Yes, thank you. Thank you.
Yes.
So in other words, they would go into emergency room Monday, Tuesday, Wednesday. It'll be collected on Tuesday. That's the flow sheet. They go into ICU Thursday, Friday, Saturday. It will be collected on Friday.
On the Friday, yes.
Okay, good. All right.
Yes.
That's clear.
I mean, this is how we starting off now.
Yeah.
It's subject to change.
Yeah.
The first week will bring in any of the hiccups.
Yes.
But that is what we're proposing. All right.
Okay.
And as I say, my groups are for anybody is free to email me. But those groups that I am supervising for 8 weeks, 4, 8, and 10, feel free to further email me your concerns. All right.
Okay.
Yes.
All right. So good. All right then. So thank you all for joining us. The PowerPoint and the video I will post as soon as I get that. I will actually post, I have a group already, so I could post that in there and then they could share. They could share it until then. And then Mr. Vo, I could send it to you and you could post it as well in your group. Okay? All right. Have a good one, everybody.
Thank you. Good day.
Bye-bye.